this is Sarah Mikesell with thepigsite.com, and today we're here with Dr. Chris Richards. He is a practicing swine veterinarian with Apiam Animal Health. So thanks for being with us today, Chris.
Thank you. Great to be here.
Today we're at the AASV conference in New Orleans, and you just gave a presentation about pharmaceutical use in Australia. Can you give us some of the headlines that you talked to veterinarians about today?
Yeah, so the presentation was really an Australian experience on antibiotic usage. Antibiotic usage globally is certainly under pressure, and I think every country and every veterinarian is certainly assessing how we use antibiotics. Taking into consideration some of the external factors that are putting pressure on our industries around the use of antibiotics. So my talk was really, was outlining that Australia, it's a fairly clean country in terms of diseases on a global space stage. However, we still have a number of challenges from a number of bacterial pathogens where we have to use antibiotics. Use vaccinations as well, but in most cases we have to use a combination of vaccines and antibiotics. So the other thing about the talk was really about focusing on prudent use, and if we're going to use antibiotics, it's really a privilege rather than a right, and that and we need to make sure that we're very compliant in terms of making sure that we're only using it when we absolutely necessary, that we're selecting the right antibiotics for the right pathogens, and that we're diagnosing individual sick animals and treating individual sick animals rather than having a mass medication policy. So with that, it was really about how we record our medication usage, how we can look at tracking effectiveness of treatments, as well as some training programs that we've been implementing in order to make sure that we have antibiotic stewardship in our industry.
Can you talk just a little bit about the program that you use, your veterinarians use in Australia to record use? It was very interesting. It's all cloud-based, based on what I can understand.
Yeah, so I was talking about a relatively new program called iVet, and it's a cloud-based system where vets are determining the veterinary plan on a farm, and that's entered into a cloud-based system. The farmer then is using that system to help in choosing the right product to use for the right clinical signs and the right disease. And then that is all getting recorded in a cloud-based system that a vet can then log in, review what clinical signs are happening on farm, review what medication is being used, and look at efficacy of treatments. So all with the aim of reducing the amount of antibiotic usage by identifying more quickly what diseases are happening on farm and responding to those outbreaks.
Very good. It sounds like a lot of communications required between the operators and the veterinarians. I mean, the program looks successful though.
Yeah, so the important thing is that what it is doing is really improving the communication between what's happening on farm and what the veterinarian is thinking is happening on farm, and that way we can get a lot more successful outcomes for the pigs.
Yeah, it certainly seemed to provide a lot of transparency for everybody. So
yeah,
very good. Well, thank you so much for your time today, Chris.
Thank you.
This is Sarah Mikesell with thepigsite.com.